Does medication compliance matters in mental health care? That's the question I want to ask today. Medication non-adherence in mental health is a significant issue, with rates often exceeding 50% of conditions like schizophrenia and depression, leading to relapse and hospitalization. Does medication matters? Please leave a comment. Barriers include unpleasant side effects, lack of insight, forgetfulness, and stigma. Effective strategies include shared decision making. Welcome to Growth with Joyce. We the future, confidence in action. Yes, we want to explore that. Key challenges to adherence. Side effects. So the side effects are weight gain, sedation, physical discomfort, make patients want to stop medication. Lack of insight, denial. Patients may not believe they are ill or need medication, particularly in psychosis disorders. Forgetfulness, complexity, multi-dose regimes are difficult to manage. You believe that? Please leave a comment. Stigma, attitude, fear of being judged or negatively towards psychiatric medication. Feeling better, patients may stop medication when symptoms subside, believing they are cured. Strategies to improve adherence is for you to build therapeutic alliance, open non-judgmental communication between patients and providers. It's so essential. Simplify regimes. Use once daily dosing or long-lasting injections to remove the need for daily action. Education for patients and families about the illness. The practical aids using pill boxes, smartphone alarms, and linking medications to daily routines like breakfast. It can help. Shared decision making involving the patient in treatments is very good. It increases their investment in the plan. Please, have you subscribed yet? If you haven't, please do. It will help the channel to grow. So, however, it might take time for some people, while others, it might be quicker. However, when the disorder condition happens, it becomes enduring. It might take a while for it to work. If not, the doctors would have to review the medication and start a new treatment plan again. Consequences of non-adherence. When patients don't want to tell, what are the consequences? There's a lot. Risk of relapse, more hospitalization, readmission, poorer overall quality of life, and long-term functioning impairment. It increases healthcare costs. So, from my experience, one of the issues of non-adherence is patients always feel they don't need the medications. But the truth is, most of them is because they don't have the understanding of the medications. They don't feel they are not well. They don't feel they are unwell. So patient needs to be encouraged all the time for them to take their medications. Then we will argue and say, what if when the patient goes to the community, how will the patient comply with medications? We have other team in the communities that are called the community teams, care coordinators. So patients are assigned to them. So the care coordinators, they monitor the patient's medications so that they can be compliant. Some of them might not want to comply. So the care coordinator has to encourage the patient to take the medication by educating the patient, telling the patient the benefits of taking the medication. Fine, there will be some side effects, but the doctors usually they weigh the benefits against the side effects. If the benefit is more, they will have to give the medication, because eventually almost all medication, they all have side effects. So, but they have to weigh the benefits to what is happening and give the patient the medication. And also, some people feel it's not easy to take the tablet. That is true. It's not easy to take tablets. For you to wake up every day, you drink medication, another day drink medication, but there are other ways you can take medication through depot, which is your injection form, so that you don't keep taking medication every day on a daily basis. Then the doctor can put you on that injection depot. So even if it's weekly or 2 weekly or monthly, 3 months or 6 months or 1 year, it will be easier for one to manage. So that with that, your care coordinator can come to your home and administer it, or you go to a center and they administer it. So they have to weigh the risk to know if to go to your home or to go to a center. As well, anytime you go, you'll be educated the importance of the medications. It is not advisable for anyone that is going through mental health challenges to just stop their medication. Consult with your doctors first before you stop it, because if you do, you will relapse. It means you become unwell again and you'll be admitted again, and that means you'll be going round the circle, so which is not good for one's health. So adherence, compliance of medication is important. I know there are side effects. Some medications like olanzapine, it gives you more appetite to eat, so you'll be increased in your weight. There will be weight gain, but it can be managed. You can change your lifestyle, change the food and everything, how you eat, so that can be managed. And also you have clozapine, it gives you appetite to eat as well, so that can be managed as well, because that one is monitored with regular blood checks. So some of these medications, it can be managed. You just have to try and change your lifestyle. You exercise more and do your best and eat well. That can be managed, because if you stop it just because you feel you are well, you might become unwell again. So always consult with your doctors before you stop any medications, to avoid relapse, to avoid you not being able to function well in your community because you might be working. So thank you so much for taking the time to listen to me today. Please, if you haven't subscribed yet, subscribe, share the video, like, comment. That's the way we will grow in this community. We are here to grow. Growth with Joyce. Thank you so much. We the future, confidence in action. Thank you. Bye-bye.